Is there anything else I should know? I know.
Hi, everyone. We're the Causes of Autism debate group. And our group today is going to be composed of 4 members. We have me, I'm Anja. I'm the stater, and I will be tackling the potential prenatal causes of autism. We have Ryan, who's our moderator, and will also be hitting the potential genetic causes. Angie will be doing postnatal and the idea that autism is just a social construct. And Danielle will be tackling all of our rebuttals. We had a really interesting group question that kind of sparked how the structure of the debate was going to go. And it was this: the prevalence of autism continues to rise. However, there remains to be a lack of research that identifies a specific cause. Many parents, advocates, and people diagnosed with a disability want to know the cause, and some are hesitant to accept the limitations of the available science. We were tasked with reviewing the research and discussing the ethical dilemmas that were associated with this. We were asked to discuss the impact that the discrepancies in the information had on society, and we had to look at what our ethical responsibilities were as people who provide services to children and adults on the spectrum. We started by having everyone take a survey. We had 100 people that took it, and we asked them about their beliefs concerning the potential causes of autism. The sample population consisted of teachers and other professionals who work in the field of ABA, friends and families of people with autism, and people with absolutely no connection to anyone on the spectrum. As you can see, the respondents were fairly evenly distributed among the 3 groups. The second question on the survey required them to make a very, very significant choice. We asked them to decide what they thought the primary cause of autism was. Was it genetics? Was it the environment? Was it prenatal care? Or whether or not they thought maybe it was just simply a social construct. As you can see, the vast majority of those who completed the survey thought that genetics were the primary cause of autism. Our third question regarded how they thought autism could be treated. We gave them options that were things like therapy, so like speech therapy, PT, OT, ABA, medication only, something else entirely that we hadn't thought of, or whether they thought it was simply a social construct and then therefore didn't need to be treated. As you can see, most people believe that therapy was the best method of treatment. The results were kind of all over the place, but we thought that the survey gave us a good example of how wildly public opinion varied. The majority surveyed thought that genetics was the cause and therapy, though, was the best method of treatment. Our team position was that there were arguments to be made for and against each of the potential causes, but as practitioners in the field, we as a group agreed that there's no specific singular cause of autism and that using evidence-based practices was the best way to treat the disorder. Our job is to improve the quality of life for children and adults with whom we work, and we don't necessarily need to have a definitive answer about the root cause of autism to do that.
It's Ryan again, and I will be moderating this debate. We will be discussing 4 topics today: the causes of autism, including genetics, prenatal, postnatal, and autism as a social construct. We start the discussion by talking about potential genetic causes of autism. I will be talking about it, and I found 3 things that I found pretty interesting. And the one that stuck out most to me was the twin study. There's also testosterone in immune dysfunction. The twin studies has probably the most results out of anything that proves genetics. It really took off in 2011. They take identical twins and fraternal twins, and they study which one would have autism. Fraternal twins usually have 50% of their genes that are similar, and identical twins are about 100% similar. With the results of those, it came out as identical twins are more likely to have a twin with autism over fraternal twins. The study that goes into those are the genome, and they study the 2%, which is the proteins, and those are most likely to change. And usually it's inherited, or it has the de novo gene, which is not inherited, but you can get autism from that, from such as sexual contact with intercourse and different things. Transcriptome, it measures RNA, and is a result of 400 genes that are differently expressed between the cerebral cortex, which controls the brain for individuals with autism. And the research is trying to solve the mystery. And immune dysfunction is with individuals on how they mature in the womb and different things that can happen. And if they usually have a lower immune dysfunction, they tend to not develop brain functions, which causes them to have autism. Now, Daniel will be presenting the counter-argument for genetic causes of autism.
So one of the reasons we feel that autism is not caused by genetics is oxidative stress. Oxidative stress is the imbalance between the production of free radical cells and the ability of the body that counteracts or detoxify the harmful effects of the neutralization by antioxidants. The antioxidants are molecules that are presented in the cell that prevent reaction from donating electrons. The imbalance between oxidants and antioxidants cause the underlying basis of stress. Our second theory for why genetics does not cause autism is a phenomenon. These are two hypotheses that argue that genetics may not be a result of autism, instead as a result of prenatal and postnatal complications. The second explanation suggested that environmental factors and autism go hand in hand. Our third reason why genetics is not responsible for autism would be gene-environment interaction. This is an explanation of the absence of replication of association within the studies of autism. There has been data that has been collected that has exposed subjects of the same environment which are more likely to get autism compared to studies that have kids with autism in the different settings who do not get autism. These studies rely on synaptic functions.
Moving on to our next category of causes, Anya will be making the argument for potential prenatal causes of autism.
Thank you. So far, the majority of autism research has gone through genetics, looking for a cause. Several studies of twins, as Ryan mentioned, have been conducted, which seem to indicate that, yes, there is some link, but there's not really enough evidence to say that it's definitely the cause. The stronger argument is for mutations that happen during pregnancy. A connection between low vitamin D during pregnancy and autism was discovered in a 2015 Swedish study. In places with less winter sun, more children with autism are born in the winter and spring, with the highest concentration in March, something that is not repeated when compared to places like Israel or California, which don't see the same extreme seasonal variation. There is also a disproportionately large number of African and Middle Eastern children in Scandinavian countries born with autism when compared to white Scandinavians. So melanin, as you know, prevents the synthesis of vitamin D, which has led to other medical issues in similar populations. And low vitamin D in mothers is already linked to language delays. During the winter months, there's also an increase in the likelihood of infection, which can lead to potential gene mutations while in utero and damage to maternal nutrition. Right now, one of the major contributing factors to autism is thought to be a folate and/or folic acid deficiency, which can be the result of either a failure to take it during pregnancy or the depletion of this nutrient in the mother's body if the time between her pregnancies is very brief. So we already know that there are neurological issues that arise from poor nutrition, which supports the idea that autism could have a similar cause. The highest risk right now is with mothers who have children who are fewer than 18 months apart. Lyle, Schmidt, and Hertz-Piatto did an analysis in 2014 of ASD risk factors, and it revealed an elevated risk of autism when a mother was exposed to chemicals and pollutants, especially in the third trimester. This risk was also high for families who lived near freeways and other traffic-related pollutants due to elevated ozone and nitrous oxide, both of which are a risk during the entire pregnancy. Air pollution causes central nervous system issues and blood-brain barrier complications. And in animal studies, there were significant behavioral deficits in the offspring of animals who were exposed to those pollutants during pregnancy. So I think that all of that kind of supports the concept that maybe there's something going on in utero versus it being just a purely genetic or social construct or postnatal cause of autism.
Thank you, Anya. Daniel will be presenting the counter arguments for the prenatal causes of ASD.
Firstly, not only do prenatal arguments make the mistake of ignoring genetics, but being a first child is already a risk factor for ASD. If children aren't receiving a diagnosis until they are at least 2 or 3 years old or even older, you cannot necessarily say that number 2 would not have been on the spectrum if the pregnancies had been spaced out further. You're already more likely to have a second child with autism if you have one, which implies it could be entirely genetic, and people with a child already diagnosed have an opinion to not have any more if they choose, unlike those with a short interpregnancy interval. Going into the anti-causes for prenatal, we will talk about the vitamin D study next. The vitamin D studies have had small sample size, which is not representative of the ASD population as a whole. They excluded the age of the parents during the mother's pregnancies, but the children involved in the study were the younger sibling, if they had a sibling, which may indicate that age could be a risk factor. Not only does it take into account the potential for genetic origin of low vitamin D levels, but there was no research conducted on women from the same cultural background wearing similar clothing in a similar environment. A study was conducted on minority women in California and in Scandinavia, 2 places with entirely different amounts of sunlight and completely different weather. Although both groups of women wore skin-covering clothing, the women in California have had more opportunities for exposure to sunlight and synthesizing vitamin D. Therefore, these studies are very inconclusive. Lastly, I'm going to talk about air pollution. Air pollution is thought by many to be a potential cause of ASD, but samples taken 2 years after birth, as in the study you referenced, do not capture prenatal exposure to pollutants. These studies were also regional, and the researchers failed to compare them to the pollution across the United States or worldwide. The elevated risk revealed in other studies is non-existent when you adjust from demographic factors which already increase the likelihood of ASD. There has been no analysis of specific chemical compounds that make children susceptible. Air pollutants is a very, very vague term. They cannot eliminate a sufficient number of other potential causes to narrow it specifically to air pollution during pregnancy alone.
Now we turn to Angie. She will be presenting the argument for potential postnatal causes of autism.
So the first thing I'm going to talk about is exposure to chemicals. According to a parent study done by Schultz from July 2005 to January 2006, this study consisted of 83 children who had ASD and then 80 controlled children. When acetaminophen was administered after the MMR vaccine, it was slightly associated with an autistic disorder when the child was 5 years of age or less. But on the other hand, when ibuprofen was used after the MMR vaccine, it was not associated with ASD. It did say, however, that autistic disorder was associated with the use of acetaminophen after the MMR vaccine. And the second thing I'm going to talk about is gut bacteria, which is different in different people with and without ASD. And changes in gut bacteria produce ASD characteristics. And gut bacteria is already proven to cause other diseases and has a connection between the brain and the gut microbes, and a leaky gut produces more toxins in the brain.
All right, now we move to Danielle. We'll make the counter arguments for potential prenatal causes of autism.
When talking about chemical exposure, there is no information about the extent to which the chemical exposure affects the changes of people developing with ASD. There's no proof that the exposure causes more adverse effects, which is the natural assumption, or what could be done to mitigate the risk. If small exposure has the same risk, why don't more kids have ASD? Mostly animal studies and studies that involve rats, which may or may not translate to humans. No information about risk window, as studies show it is equally harmful during pregnancy, cannot identify which chemicals pose risk, and do not consider genetic susceptibility enough. Also talking about gut bacteria, no studies have touched on the transfer of healthy bacteria into patients with ASD. No evidence that probiotics relieve ASD. There's no evidence that probiotics relieve ASD characteristics, and gut bacteria differences may be the result of diet in children with ASD and not a cause of ASD itself. We all know these kids are picky eaters. Same with neurological issues. Not sure which one comes first. Thank you.
Now Angie will present the argument for autism being a social construct.
So the first one is that autism is just a word that has been over-publicized. So autism is a social construct because it has been publicized and advertised through the education system and through social media. And through recent years, the use of the word autistic or having autism continues to grow rapidly. Autism is shaped by social phrases and meanings that societies attach to it. And secondly, autism is a social construct because a lot of the times individuals that are diagnosed do not meet the criteria of the DSM-5. And the DSM-5, if you aren't aware, stands for the Diagnostic and Statistical Manual, the 5th edition. So in the DSM, individuals diagnosed with Asperger's and PPD were widely diagnosed with ASD. So what happens to those individuals who have been diagnosed previously and now do not meet the new definition? Some individuals have a couple traits, but oftentimes do not have both common communication deficits. Do not have both common characteristics of the DSM-5, which are language and communication deficits, and repetitive or stereotype behaviors. However, due to the publicizing of autism, people will still label them or identify them as having autism. And finally, labeling someone with autism is not person-centered. So having autism cannot take away a person's self-identity. It affects the way people are perceived by others in school, in society in general. And this can cause negative effects, including bullying or them having a self-identity crisis.
And finally, we have Danielle with the rebuttal.
Okay, so I am going to talk about why autism is not a social construct. If autism were a social construct, then the individuals who have autism would not have access to the different services and treatments that are out there. They wouldn't be able to get the different therapies they need because oftentimes, if you have a diagnosis, you have access to different waivers. In Virginia, we have the ID and the DD waiver. You also have access to occupational therapy, speech therapy, physical therapy, ABA. And as you saw in our survey, 80% of the people that we surveyed thought that therapy is how you treat autism. And so if we didn't have the diagnosis of autism, a lot of these individuals would not be able to get the services that they need. Autism is also not a social construct. It does not oftentimes meet the DSM-5. Some would argue that autism does meet the DSM-5 because both traits are needed for the diagnosis and both traits are observable and measurable. There was a recent study done that shows that the new DSM-5 is more correctly diagnosing individuals with autism, and less people who do not have it are not getting diagnosed with it. The study evaluated 5,000 children, and the results showed that 91% of those individuals were correctly diagnosed with the new definition of the DSM-5. Since our audience question fits in well with social construct, I will also be going over that. Dr. Dickey asked us, as you mentioned in your outline, there are many theories and very little evidence for what causes ASD. You mentioned social construct specifically. There was a recent change in labeling high-functioning autism with the DSM-5 versus the DSM-4. Instead of labeling Asperger's, the label is autism or ASD only. Not sure how many of you know that. Do you feel that these labels would have an impact on the groups of the individuals and how they are viewed, treated, or how they view themselves? And so after some research, I feel confident in answering this question. A lot of people have argued that the new definition of the DSM-5 is raising concerns and having an impact on individuals with autism and individuals previously diagnosed with labels such as Asperger's and also PPD-NOS. Their rationale for this new definition is because autism is defined as a single set of behaviors, it is best to give it a single diagnostic category, such as mild, moderate, or severe. Some argue that people with Asperger's look different and have different needs, and with the new criteria, a lot of people are concerned that the people with Asperger's diagnosed with Asperger's will be removed from the criteria and could potentially result in loss of diagnosis and would be unable to receive the necessary services, which is very, very concerning. Some of these services could be schools, private therapies, insurances, or Medicaid would not be able to cover these things unless you have a diagnosis. This could also result in a self-identity crisis for individuals that identify through their diagnosis. I feel if they are going to be strict on the DSM-5 definition, they should look into having those previously diagnosed with Asperger's or PPD, NOS. They should look into those look into having them grandfathered into a new definition. And it would also be beneficial for companies and insurances to provide therapy outside of people who have a diagnosis of autism, if it were to be prescribed by a physician or a therapist. So say someone just had severe social skills and they needed ABA therapy to work on that. Maybe their doctor could just prescribe them with ABA therapy, and that way it would be covered. So that way, others who did not meet all three criteria can still receive the services that they need.
Thank you, Danielle. We had a second audience question, of course, and it really fit in well with our team positions. So in answering it, I'm also going to give a summary of the conclusion that we reached at the end of our research. So our question was, as a future BCBA or therapist implementing ABA, how would you explain your stance to a parent who asked the causes of ASD? Explain how you would inform them of your stance, as well as what ethical codes you would cite when explaining ABA's stance on cause and treatment. As professionals, we collectively agreed that there was not enough information to determine a clear cause of autism. It is not uncommon for parents of children with ASD to have why questions, namely, why does my child have autism? Historically, people have believed that autism was a multitude of things. A form of neurosis, even a psychotic condition, but present day researchers believe that there really is no simple explanation or single cause of ASD. However, as someone who is not a researcher investigating causes, it would be outside of my realm of expertise to comment on potential questions that a parent may have about it would immediately be replied to with a similar sort of answer. This is in accordance with Rule 1.02a, which states, all behavior analysts provide services, teach, and conduct research only within the boundaries of their competence, defined as being commensurate with their education, training, and supervised experience. Should a parent or someone otherwise affiliated with my client wish to be pointed in the most appropriate direction for exploring the available research, I would refer them to the same literature that we review as BCBAs. There is a lot of research available online in ASD-related scientific journals, which explore the methods through which people are gaining insights into the potential causes. But there is also a lot of misinformation and unverified claims, as I'm sure you're all familiar. Without endorsing any particular method of thinking, I would advise anyone in that situation to conduct their own literature investigations of scientific journals. And that goes back to our code of ethics again, Rule 1.01, which states behavior analysts rely on professionally derived knowledge based on science and behavior analysis when making scientific or professional judgments in human service provisions or when engaging in scholarly or professional endeavors. it is the same scientific knowledge that we rely upon to come up with the most effective treatment for our clients. The protocols and implementations we use are based upon proven methods, which is a best practice method of behavioral therapy. The Behavior Analyst Certification Board requires us to advocate for and educate the client about scientifically supported, most effective treatment procedures. Rule 2.09a also defines effective treatment as that which has been validated as having both long-term and short-term benefits to clients and society, neither of which requires a firm knowledge of the causes of autism. As a behavior analyst, I would explain to any new parent or current parent with questions, because we know they all have them, that we treat the behaviors exhibited by the child regardless of the root cause of autism itself. ABA is behavioral in nature, which means that we study physical events or what a child is able to do rather than what initially caused the symptoms to manifest. That's it for us. Thank you guys so much for watching. Have a good day, night, whatever it is. Thank you.